Okay, hope everybody is having a wonderful day. So, we were supposed to have a guest today, but he couldn't make it, and we will reschedule. We're going to discuss his health journey around lupus, which is an autoimmune disease. Therefore, I'm going to take this time and talk about a topic that is recurring in my office, and that is AI in health. One of my patients called AI almost intelligent, and I thought that was definitely a wonderful profile for AI, and it's good and it's helpful, but it's not foolproof. So I'm going to say something a little bit controversial that AI should not be managing your health. And neither should crazy influencers. Some are good, many are crazy. You shouldn't follow random supplement protocols that you find online. I think that's absolutely bonkers. And if you're using ChatGPT, Google, TikTok, or Instagram to diagnose yourself, well, we need to take a step back and talk about that. Let me be clear. AI is powerful. I love it. It's fun. It's impressive. It can summarize research and it can suggest meal plans, and it can list you supplements as well. But it's not personalized medicine. It does not know your history. It does not know your stress load. It does not know your hormone patterns. It does not know what your labs looked like 3 years ago. In fact, it gives you information, not interpretation, not always, not clinical judgment, and not always a strategy. And information without context, well, that's dangerous. Here's what I'm seeing in practice. Patients come in convinced that they have adrenal fatigue or mold toxicity or histamine intolerance or estrogen dominance because AI told them so. There are multiples of supplements, so many supplements sometimes, and their gut kills them. They've eliminated 10 foods. They're afraid of carbs, they're afraid of protein, they're afraid of fats, they're overwhelmed by what they should eat, or maybe they should just stop eating altogether. They're afraid of stress, they're afraid of their own lab markers, and they're anxious, they're exhausted. And they started so many different things that didn't work. And they suffer from SMF, social media fatigue. It's just so much and so overwhelming. Now let's talk about supplements, because this one needs to be said. We talk a lot about this in the office. Most people are self-prescribing. Some people are taking something for adrenal support, never testing the adrenals. Some take iron without ever checking ferritin. Some take thyroid without looking at the complete thyroid panel. Or they take probiotics without confirming what's actually happening in your gut. Maybe you don't even need probiotics. More supplements does not always equal better health. If you need 42 supplements to function, that's not optimization. That's great marketing, what that is. Supplements should be targeted. They want to be strategic. So, and here's another controversial one that we see is that normal labs do not mean optimal health. You can have a normal thyroid marker, but yet poor conversion of thyroid. You can have normal glucose and already be insulin resistant. In fact, you can have a ferritin range and still be functionally depleted. And that's talking about iron. You can be inside the lab range and still feel terrible because ranges are statistical. Optimal is clinical. I want that to sink in. And I hear this every day. I'm just getting older, or this is what happens after 40, or my metabolism must be slowing down. That's normal stuff that heal. But sometimes it's not aging. It's not metabolic dysfunction. It's stress physiology overload. It's gut-driven inflammation. It's insulin resistance. It's hormonal shifts and imbalances that just were never addressed. And no AI prompt is going to entangle that for you. Let me ask you something. How many of you are taking more than 15 supplements right now? And I love supplements, but sometimes it's just too much. And how many of you have been told that your labs are normal, but you don't feel normal? That happens a lot. And that gap, that space between normal and optimal, that's where strategy matters most. So here's the bottom line. You don't need more random advice. You don't need another TikTok protocol. You don't need another influencer supplement stack, and you don't need another restrictive diet. And you don't need to eat sardines every day. You need a strategy. You need a personalized plan. You need root cause investigation, targeted testing, clinical interpretation, lifestyle integration. That's what's needed. That's what optimizing health is meant to do. Not guess, not chase symptoms, not overwhelm you. You want to build a plan. So if you're tired of guessing, start with clarity. Take one of our gut quizzes, download the chronic fatigue cheat sheet, or schedule a 15-minute discovery call. That's where you and I get to talk to each other and find out how we optimize your health. And stop outsourcing the algorithm. Start building a strategy because your body is not a template and your health deserves more than random advice. If this resonated with you, share it. Drop your biggest frustration. Tell me what's happening in your world. And we see a lot that's happening in the health world. So until then, stay healthy and strong, and we'll see you at the next live. Take care.